Good evening, friends. I am Dr. Suhashis Mukherjee. I am a practicing obstetrician and gynecologist. Today, I have come in front of you to speak about a very important topic, which has been, should I say, a taboo or a big nightmare for the entire world. It's breast cancer. Do you know that in every 4 minutes, one woman has been diagnosed with breast cancer, and every 8 minutes, one woman dies of breast cancer? This is the rampant growth of breast cancer. And do you know why? Because the taboo which we have associated breast cancer with. We have many people in our families who might have or might be suffering from breast cancer, but they will never come forward because of this taboo which we have in this society. So I have come in front of you to speak a few words so that you all can understand it is high time we should come forward and make this a important point of discussion so that our mothers, our sisters, our aunties, any female we know are comfortable to speak about it, to come to a doctor, to come to a sister, to come to a health professional and describe their problems. See, breast cancer is so important because we cannot prevent somebody who is going to have breast cancer. It is our duty to make that person aware so that they can come to a health professional in the right time so that we can help to sustain it or to stop it at the right moment so that her future life she can have a normal life. Now, you might think, why is breast cancer so important in India? Because all around the world, cervical carcinoma is the topmost carcinoma in the world, and breast cancer comes second. But in India, breast cancer is the first cancer which has taken the first spot among all the cancers. Now, why this is in India? So there are some few risk factors which, should I say, predisposes somebody to breast cancer. First is sex. See, breast cancer is mainly known as a female disease, but you might be surprised to know that many males also suffer from breast cancer. So it is not only gender specific, but yes, it is much more common in females. Second is those females who attain their menopause or who stop their having periods after the age of 50. They are more prone to suffer from breast cancer. Third are those patients whose near relative like mother, sister suffered from breast cancer. They may or they have this predisposition to get breast cancer. And another is if somebody already had breast cancer in one breast, can also have breast cancer in the other breast. Along with that, there are many things which we are responsible, like our hectic lifestyle or bad food habits, and also taking over the counter oral contraceptive pills or hormonal pills without consultation of proper doctors. So if we can prevent all these risk factors, say sex that is unpreventable, our healthy lifestyle, we can be sure that if we follow a healthy lifestyle, if we follow good routine, if we take healthy food, if we don't take over the counter medicine without consultation of doctors, we may very much prevent or reduce the incidence of breast cancer. Now say somebody thinks, how do we know if we are having breast cancer or something? See, breast cancer is something, it's a disease where the cells of the body, or should I say the cells of the breast, grows in a or multiplies in a rampant manner so that the tissue increases abnormally, and as such there might be a solid, I hope you will understand, lump or a solid mass. So the first thing which can make you think that you should go to a doctor is a solid lump in your breast. So how would you know? So there is a technique, or should you say examination, which you can do every day in your own house, which is known as self-examination of breast, which you can do while you take bath or while you sleep or any leisure time you have. You just have to examine, you have to divide your breast in 4 parts and use your one hand to press and see if there is any solid hard lump you feel. If you feel so, it might not be breast cancer, but I would ask you to visit your nearest doctor so that he can also confirm that. Because sometimes if we take this lightly, it might be a breast cancer. So you have to be careful, and you should know how to do self-examination of breast. And those who have risk factors, they should obviously go to a health professional for breast examination. Another thing is the annual breast examination. Every woman of the age above 40 should go for an annual breast checkup, so that if there is anything which gives the iota of doubt to the doctor, he can go for investigations to know if it is a breast cancer or a simple lump. Because many a times patients or females, they fear that any lump can be a breast cancer, but no. A female can naturally, because of her menstrual hormonal cycles, can have lumps in their breast which will go away naturally. So for every lump, you need not worry that it will be a breast cancer. That's why it is very important that you visit your nearest hospital or nearest healthcare professional to be sure that it is not a breast cancer. Another thing, as all around world has determined October as a breast cancer awareness month. So every year in the month of October, government tries to do programs, awareness camps, and do free examinations for patients so that in early stage breast cancer can be detected. I would ask you or request you that in this kind of, if you know of any this kind of programs, please go, visit, and take advantage of these programs so that you can know if you have any such problems. I hope all the discussions we had made you understand about the seriousness of breast cancer. And as I have said before, breast cancer is very difficult to prevent. So awareness is the key. If you are aware, then you can prevent it. Or should I say, you can make life livable after breast cancer. Because I can give you examples of millions of people who had suffered from breast cancer but are now hale and hearty. You should have a healthy lifestyle. You should have healthy food. Be careful to know if you are one of the person with all risk of breast cancer. So I would ask you to share this video to each and anyone you know, so that we can make people understand that breast cancer examination or breast cancer checkup should not be deferred, and this taboo in our society whenever it comes to breast cancer has to be ended. Thank you very much, and I hope you will have a hale and healthy life. Thank you.